Hello, hi, good afternoon, everybody. My name is Miguel Arce Rentería. I'm a neuropsychologist, and I'm here to talk to you about bilingualism and cognitive aging research, right? The title specifically of this talk is Deconstructing Bilingualism and its Sociocultural Determinants for Research on Cognitive Aging. Quickly, just to begin, I'd like to say, in terms of disclosures, quickly, I am bilingual myself. And so as you'll see, we'll talk about a lot of the research in terms of bilingualism in cognitive aging. It's about that it provides some kind of benefit or protection towards developing dementia and reducing the decline through cognitive aging. It's obviously, as a bilingual myself, I am, invested in hopefully this is true, but I remain as obviously as objective as possible through the scientific work that we do. In addition, just to quickly mention, I'm funded by the NIA and the Alzheimer's Association to do this kind of research, and I'm also the co-chair of the Bilingualism, Literacy, and Language Special Interest Group of the Diversity and Disparities PIA of the Alzheimer's Association. So just to provide a quick background, there is some literature to show that bilinguals may be able to retain similar levels of cognitive functioning in the face of age or AD-related, Alzheimer's-related neurodegeneration compared to monolinguals. There is several studies that show that bilinguals compared to monolinguals will develop Alzheimer's disease later in life than their monolingual counterpart. However, there are several other studies that say that perhaps this is not the case. We're also obviously here because several strong studies do not find support for bilingualism as a protective factor. There are a few things we need to mention across all these different studies that it's important to describe the methodological differences across them. Some of the key ones are related to study design. So for instance, exclusively, if anything, almost all the studies do find benefit in terms of cognitive aging and Alzheimer's disease risk among bilinguals compared to monolinguals. They all tend to be retrospective studies, meaning that these are, and also clinic-based, so meaning that they're patients seen at a clinic at a given time, and then from there, either they have dementia or they do not. And then from that evaluation, they're able to try to obtain information retrospectively of asking the family members whether they developed, when did they develop symptoms, when was the diagnosis happened, and to figure out a time frame for that. And it's also cross-sectional, because it's just that one time point of a visit. And so first, these studies have these, and so some of the challenges of retrospective studies are that they are susceptible to selection bias due to the use of patients at memory clinics, and using a patient, family member, caregiver recall of time of first symptom can lead to potential recall bias in caregivers reporting of date of patients' first dementia symptoms. However, the studies that do not find a benefit in terms of AD risk and cognitive decline, they're largely prospective studies, meaning that they're being followed individuals over time, and they're also community-based, which allow them to be a lot more generalizable results than the selection bias that can happen from a clinic-based sample. And in the same way, they're longitudinal as well. And so an ideal approach to investigate whether there's a causal link between bilingualism and protection of cognitive aging and Alzheimer's disease risk is that you would require a prospective cohort study of community-dwelling bilingual individuals who are free of dementia at baseline, so cognitively normal. You have a baseline assessment of bilingualism, and ideally assessing bilingualism over time, and then frequent waves of data collection with a long follow-up period, and obviously then with the determination of a dementia diagnosis by a team of experts that include neurologists and neuropsychologists, following research criteria that's standardized as well. So this would be the ideal approach to try to obtain a causal link between bilingualism and its protection for Alzheimer's disease risk. And another important factor is that also that that the participants receive culturally and linguistically appropriate cognitive evaluations. Given that the fact that they're bilingual, right, it might be, there are biases inherent in the testing if you do not evaluate them in the language that is the most appropriate for them, if you're not using the instruments that might be culturally sensitive, culturally appropriate, and linguistically appropriate as well. And so all these factors need to be taken into account. Besides these large study design differences that I mentioned, there are other methodological differences that may explain some of these inconsistent findings, where some studies find a benefit, some studies do not. So first of all, it comes down to what is bilingualism? How is it defined? You'd be surprised how inconsistent the definition of bilingualism has been, with some studies using a simple yes or no self-report, and others using more strict definitions, such as a certain level of proficiency has to be obtained in both languages. Beyond that, most studies focus on establishing group differences between bilinguals and monolinguals in terms of their ADRD risk, and treated bilinguals as this monolithic group. And however, bilinguals can differ on various characteristics, including age of second language acquisition, degree of proficiency, frequency of language use, that may influence cognitive aging. And in addition to that, there is also an inconsistent control for potential confounders. For example, bilinguals and monolinguals can differ in critical environmental and sociocultural factors, such as educational experiences, socioeconomic status, immigration status, that these factors influence the ability or the opportunity for someone to become a bilingual. And so all of these differences could explain inconsistent results across studies. And so to move forward, let's dive into all these issues a little bit in more detail. And so given these issues, we need to deconstruct bilingualism into its different components that may be providing resilience or reserve in the context of cognitive aging. As indicated before, it might not be the most beneficial to just say bilingual, monolingual, yes or no. It's best to understand what are the active components. So all of these factors have been associated with cognitive and structural outcomes. For instance, brain structure outcomes. For instance, individuals with early bilingual age of acquisition tend to not only have higher second language proficiency, but may demonstrate better cognitive control, meaning better performance on measures of executive functioning, because obviously with neuropsychological testing, cognitive testing, we evaluate a lot of different domains: memory, language abilities, processing speed. A classic one is executive functioning. It also can be described as cognitive control. And also, language usage, more so than language proficiency, was associated with changes in white matter structure in cortical regions that are related to language control. And other studies show that age of acquisition and language usage can differently modulate brain pattern of activation during lexical retrieval of the two languages. And also some studies have found better performance on measures of executive functioning among those who exhibit greater code switching, with code switching indicating the behavior that some bilinguals may exhibit of switching back and forth between languages during the same conversation. Like if you're speaking with another bilingual and then you're speaking in English, y luego de la nada estás hablando en español, and then you go back to English, and that is what code switching means. And some studies have found that engaging in that activity, those who do it more may have better executive functioning abilities when measured on standardized assessment. So given this prior work, it is critical to move away from bilingual, monolingual comparisons to best understand different aspects of bilingualism and how it may inform future interventions. This would then mimic the literature on risk and protective factors in cognitive aging, which doesn't only focus on whether a person knows something or not. Right? It focuses more on the behavior, such as the degree of engagement in cognitively enriching activities, such as how many years of education the person completed, what are the leisure activities they engage in, the amount of exercise they may engage in, and so forth. And so now I'm going to show you some studies that exemplify how breaking down bilingualism is useful in understanding its role in cognitive aging. So here I'd like to show some of the work by Dr. Tamar Galan, another neuropsychologist. She's based at UC San Diego, in which she focused on the degree of second language proficiency among a cross-sectional clinic-based sample of English, Spanish bilinguals. Here, by using an objective measure of proficiency, she found that greater degree of proficiency was associated with a later age of Alzheimer's disease diagnosis. Specifically, this association was found among those with fewer years of education compared to those with higher years of education. So providing evidence of the role of different aspects of bilingualism and how it may be moderated by socio-demographic factors such as years of education. So for example, just to walk you through these figures, so you'll see on the y-axis, we have age of diagnosis, right? So, how old the patient was when they were diagnosed with Alzheimer's disease, dementia. And on the bottom, they have the objective assessment of bilingualism proficiency, meaning, lower scores mean lower degree of proficiency to higher scores meaning higher proficiency. And as you can see, among those who have low education in this group, those who had higher scores in their bilingualism index score had a later age of diagnosis. So indicating that there might be some protective effect of this, but however, among only those with lower years of education. Similarly, in a recent study by Marco Calabria and his group in Spain, where they evaluated a cross-sectional clinic-based sample of Spanish-Catalan bilinguals, and here they deconstructed bilingualism largely based on language usage. So instead, the prior study was on proficiency. This was in language usage, defining bilingualism on a continuum ranging from passive to active bilingualism, where active bilingualism represents higher proficiency in both the second language and the first language, L1 and L2, with balanced usage of the two languages, while passive bilingualism is defined more as being able to understand the second language, but with little to no usage of it. So just indicating greater proficiency, balanced proficiency, and more usage of the languages of both equally for active bilingualism. And so here you see that greater active bilingualism was associated with a later age of onset of symptoms and diagnosis for MCI, for mild cognitive impairment. And so, for instance, here you'll see on the y-axis you have the age and in terms of onset of symptoms, age at first visit, age of MCI diagnosis, and on the bottom you have this bilingualism index score, again ranging from the lowest numbers meaning more passive and the higher number more active. And as you can see, there's a relationship where those who were more active had later age diagnoses. Now I'd like to quickly go over some of my own work. For the first study, I had the opportunity to work with a sample of 106 Spanish-English bilinguals from the UC Davis Aging Diversity Cohort. Here we dichotomized the bilingual group into 48 active bilinguals and 58 passive bilinguals, somewhat similar to Calabria's approach in the previous slide. However, here we use groups that were active bilinguals reported using both languages daily, while passive bilinguals reported an unbalanced use of their second language. And so here it's dichotomized, active and passive. And here all participants were of Latinx, majority Mexican, as we were working with individuals from the Sacramento, Northern California area. And here we wanted to evaluate using a cognitive reserve model, whether bilingualism, active or passive, moderated the association between medial temporal structures on semantic memory performance. And so this is important given that medial temporal structures in the brain, they're the earlier ones impacted by the Alzheimer's disease pathologies. Tau, which is one of the main components of Alzheimer's disease, tends to deposit in and accumulate in medial temporal structures earlier on in the disease process. And these structures are associated with memory functioning, both episodic and semantic memory as well. And so here we wanted to evaluate whether the association between structure, integrity, and memory functioning is modified by bilingualism status. Here, all models adjusted for age, sex, gender, years of education, immigration status, and childhood SES, which was used parental education as a proxy. As we said, these are all factors associated with better cognitive outcomes, and they're also in the pathway that provides the opportunity or ability for someone to become bilingual. So here on the left, for figure 1, we just have the main effects of bilingualism on cognition, which you'll see there are no differences. The passive and active bilinguals did not differ on overall semantic memory performance. And on the right, we have here the figure evaluating the moderation effect. You'll see on the y-axis, we have semantic memory performance with lower scores, meaning worse performance, higher, better. And on the x-axis, we have the medial temporal cortical thickness, meaning, towards the left, it's a thinner cortex, so reduced integrity. We're toward the right, meaning a greater thickness of those cortical structures. Here, the results are consistent with the reserve or resilience idea, such that active bilinguals at greater degree of atrophy are able to maintain their performance compared to passive bilinguals, as you see in blue. The individuals in blue have that as the relationship that you would expect, right? As cortical thickness goes down, their semantic memory performance goes down. But however, at that same level of atrophy, of reduced thickness, active bilinguals are still able to maintain their semantic memory performance. The relationship I do want to mention seems to flip at the higher end of cortical thickness, which isn't what we would hypothesize, but we need to further explore that, especially with longitudinal data that could help further evaluate this association. Moving on, I'll briefly go over preliminary results from ongoing work here at Columbia from the Offspring study, which is led by my mentors, Drs. Jennifer Manley and Adam Brickman, to evaluate the offspring of the YCAP participants. So YCAP is the Washington Heights Inwood Columbia Aging Project, which follows a large cohort for well over 20 years of individuals who were 65 and older, Medicare eligible, within the Washington Heights Inwood area, and then followed over years. And some individuals developed dementia, some did not, and and we obtained all this other information. So for the Offspring study, we're following now their children who tend to be in midlife at this point. And so participants here were 185 English and Spanish bilinguals. We wanted to evaluate here whether active bilingualism moderates the relationship between parental AD status and cognition, given that in the overall sample, there's a negative association between parental history of AD and cognition. As you can see in the figure here on the right, what we're showing here is the estimates of the association between having parental AD on cognition across the whole sample. The entire sample, which includes non-Hispanic whites, African Americans, and Latinx participants who are some bilinguals and some are not. And you can see overall, there's a negative effect on memory, attention, processing speed, and on language abilities. And so for this study, we focus again only on bilinguals, 136 active, 52 passive, almost all Dominican. And again, adjusting for age, sex, years of education, immigration status, and childhood SCS. And here we evaluated focus primarily on aspects of executive functioning, which were assessed with the NIH Toolbox Cognitive Battery. Here specifically, we looked at the measures of processing speed, set shifting, working memory, and inhibition/attention. These are all aspects of executive functioning, different abilities. What I want to show you here are the estimates in the 95% confidence interval showing the association of parental AD and active bilingualism on each of the cognitive outcomes. And so here you may notice that we did not find, so this is for active bilinguals. You'll see here that we found that active bilinguals tended to perform better on measures of processing speed compared to passive bilinguals. However, we did not find a reliable association with the other domains of attention, set shifting, and working memory. And for parental AD, you'll notice that we did not find a reliable association of parental AD and cognition, what we would have liked to have seen, right? But we did not find that here in the subset of participants given. We would have liked to have seen parental AD associated with lower scores across the domains, as we had seen in the previous slide, right? Across the whole sample, but we did not find it within this restricted sample of bilinguals. And so now the next slide is here illustrating the potential moderating effects, which we were trying to evaluate, right? Whether if the association of parental AD on cognition differed by bilingualism status, active or passive. And here the illustrated stratified models. On the left, you have active bilinguals. On the right, you have passive bilinguals. And what you're seeing there is the estimate and the confidence intervals of parental AD status on each one of these cognitive domains. You'll notice that they're about similar, and they're all obviously not reliable associations since they cross zero. And again, so indicating here that, maybe perhaps active bilingualism is not moderating this association, but then again, as mentioned earlier, there wasn't really a strong association of parental AD on cognition among this sample. So hopefully, at this point, I have convinced you that it's worth our time to deconstruct bilingualism in our studies, and to whether on our studies, and whether it provides reserve or resilience in cognitive aging. So now the key question is exactly, well, how do we operationalize this deconstruction? How do we do it? Ideally, we would use both self-report and subjective measures. We would use both self-reports, such as subjective measures, and objective measures of bilingualism. For subjective measures, you would wish to assess several domains, as we mentioned earlier, across different aspects such as proficiency, age of acquisition, proficiency in reading, writing, speaking, writing, and as well as like degree of language use across different settings, degree of code switching across different settings as well. For example, throughout my work, I use a modified version of a measure called the bilingual language profile, which is developed by Gertrude Mengual and Birdsong. And other measures, self-report measures, include the language and proficiency questionnaire, which is the LEAP-Q, or other language and social background questionnaires that were developed by other investigators such as John Anderson and Ellen Bialystok. Objective measures can vary. Personally, in my work, we are using the multilingual naming test, which is a measure developed by Tamar Golan, which evaluates the degree of proficiency in 2 languages by naming items, a long list of items, and so which allows you to develop a bilingualism index score that gets at degree of bilingualism and proficiency, as well as language dominance. And so and then building off of that, we need to continue to get creative and think about different ways of assessing all these different aspects of bilingualism that also include objective assessments, for instance, like recordings, real life documentation of people's speech, in order to evaluate how they're using their bilingualism in their daily life. And so now back to the original question, right? The original reason why we're interested in this work is that, as I mentioned, all studies that provided support, were about, can bilingualism protect against age-related cognitive decline and dementia? We're all, the ones that provide support were all cross-sectional, and I had already described the ideal study designs at the beginning. And it is important to evaluate longitudinal associations between bilingualism and cognitive decline, and how we may predict incidence of dementia, development of dementia, rather than just prevalence. And so in order to take a cognitive aging approach to evaluate whether bilingualism provides reserve or resilience, we must take into account sociocultural confounding factors. And so like I mentioned before, it's important to understand across these different aspects. So in terms of cognitive reserve, I think it's important just to provide some kind of definition. I'm not sure if you may have heard this term used quite a bit before, but the topic of cognitive reserve refers to the abilities of individuals to maintain cognitive ability, cognitive functioning, despite a known presence of a pathology. So for instance, research aimed at further elucidating whether cognitive reserve requires, it indicates that it would require the inclusion at least of 3 components to evaluate appropriately the concept of cognitive reserve. It involves measuring the status of the brain, reflecting a brain change or pathology, a clinical or cognitive performance outcome, and a measure of reserve, such as a social behavioral proxy, such as, in most studies have used like either years of education, premorbid intellectual abilities, and in our cases, bilingualism. And then the question that you would ask is whether this proxy of reserve moderates the association of brain integrity on a clinical or cognitive outcome that would be expected. For instance, in epidemiological studies, risk factors for dementia are sometimes used in the absence of brain measures. Although completely uninformative of brain processes or pathology, these models can test if individuals with higher levels of cognitive reserve proxies can tolerate higher risk factor levels, if that makes sense. So this is the ideal approach to evaluate whether a factor such as bilingualism is actually providing some kind of protection, reserve, or resilience to the detrimental effects of known risk factors or known pathologies. And so what's important to frame this around is that we need to understand that there are factors complicating the study of bilingualism, as we've discussed before, in terms of the issues related to how do we define bilingualism, how it's conceptualized, and even study designs. However, I like to think of them, I like to think of these issues, right, as enriching rather than just complicating the study of bilingualism. That being said, now I'm going to show you a complicated model that I will try to walk you through to best understand how now all these factors need to be considered within the context of cognitive aging, ideally having a life course approach, right? So because first, what we'll walk you through is like, so the way we're thinking this is happening, right, in terms of developing dementia and aging is that, you're born at some point, you're born, there's aging happens, things happen to your brain as you live your life, and then that leads to a dementia, or just cognitive decline, right? Change of cognition over time. And obviously the ultimate outcome, detrimental outcome, would be developing dementia, such a decline that it impacts in your daily life. And then we're proposing that bilingualism at some point through the individual's life may provide protection at that point. It can protect the brain itself from the effects of just aging, and as well, or it can protect cognitive outcomes, right? It can just allow you to maintain cognitive ability despite your brain developing diseases and the just aging over time and its impact on your outcomes. But what's important to keep this in mind is that, right, bilingualism isn't happening in a vacuum, right? There's a lot of different factors that can affect when you become bilingual, how you become bilingual, why you become bilingual, which are important childhood contextual factors that you would need to keep in mind. For instance, the childhood socioeconomic background of the person that would be associated with opportunities to become bilingual, as well as just your premorbid abilities, meaning what was your inherent cognitive skills at the start, as well as, years of education, the quality of that education obtained, the social neighborhood environment in which the individual grew up in. All of these factors can influence, the type of bilingual, the ability, first of all, and the opportunity to become bilingual, and also the quality of that bilingualism. In addition to that, right, migration history in this country, in the United States, immigration history is a key thing that's associated with bilingual. So immigrants tend to be more bilingual than those who are, U.S. born. And then as well, we have important adult contextual factors, such as adult socioeconomic status, overall health, healthcare access, which obviously, as we know, it's important in terms of bilingualism also as well in this country, right? Because we know that if you are not the most English proficient, the access to appropriate healthcare is limited if you're not English proficient. And also the quality of care that you will receive is also impacted by that. And what's important to know is all of these factors, in addition to be associated with bilingualism, do impact one's dementia risk as well. So through childhood SAS factors, contextual factors, they influence adult contextual factors directly, which then that in itself has an association with dementia outcomes as well. And then childhood contextual factors actually also has an association with overall brain health, as well as adult contextual factors will have an impact on brain health as well. And then lastly, as we mentioned, bilingualism isn't necessarily just a yes or no kind of thing, right? It also has all these different moving pieces that could be active pieces that potentially can provide some kind of benefit to the brain to maintain cognition as age of acquisition, proficiency, language use, and code switching. So I think it is very, very, very important to keep all of these things in mind when evaluating whether bilingualism provides some kind of protection towards cognitive aging and dementia risk, right? Because it has to happen in the context of all of these sociocultural determinants of health that are associated with both bilingualism and, well, health overall. And what's also incredibly important to keep in mind is you must know the population that you're working with. Obviously, I'm not proposing that this model is all inclusive, and exhaustive. There's obviously pieces that are probably missing from this, as what I mentioned about knowing the community, the population that you're working with, is that this will then vary by context, right? If you're working with bilingual populations in another country, be it Canada, be it India, be it other parts of the world, Latin America, the circumstances, the social determinants associated with both bilingualism and obviously aging may differ than what we're accustomed to here. For instance, in some of the work that I with a colleague of mine, Dr. Subarna Aladi, who is a neurologist in India, who does this kind of work. For example, out there, as she had mentioned that in India, bilingualism is incredibly common. That is a very common thing. And so in that kind of situation, it makes you wonder then, if you're comparing bilinguals and monolinguals, then why are monolinguals monolingual, right? Like what about that social cultural background they may have had to not develop, the use of a second language? Whereas here in the United States, where bilingualism may not be as common, but it's becoming more common, obviously, over time, it's important to understand these factors because then they relate to these health outcomes in general. And I think just to do a little exercise in terms of walking us through why this matters and why we need to keep all of these issues in mind is that I will like to break down how all these, important socio-demographic factors relate across different groups if we are not carefully describing the samples that we are working with. And so to start, here we'll work with the offspring study, the study I showed a few slides ago. First, describing, the socio-demographic factors across all racial and ethnic groups, and describing them basically between bilinguals and monolinguals. So bilinguals, individuals who learn the second language and who use it to some degree, and monolinguals are those who only use one language across both, so we have non-Hispanic whites, African-American and Black, and Latinx groups. So let's walk through, if we just do that, just say who's bilingual, who's monolingual, and let's just compare them in terms of cognitive outcomes. But first, let's describe them. Let's just see how these social demographic factors differ by the groups. So first off, we see that the monolingual group is older, that they don't differ in terms of percentages of gender distribution, but there are differences in years of education completed, where bilinguals tend to have higher years of education. So they're younger and have higher years of education. The monolingual group tends to be predominantly Hispanic, Latinx, where about 80% of them are Latinx Hispanic. So now we're seeing the monolingual group, right, is older, less educated, primarily Hispanic. They also have primarily, the majority have an income below the median of the sample, which is 35K. In terms of childhood SES, using parental years of education as a proxy, we see that monolinguals had lower childhood SES. They were primarily tested in Spanish, which makes sense with the association of primarily they were Hispanic. And they were also primarily immigrant, the monolingual group. About only 18% of them were born in the US. And lastly, and so indicating at this point, if we were to just leave it like this and then just evaluate whether bilinguals differed than monolinguals on the cognitive outcome or the association between brain status and cognition, we really need to know these groups that well, because to then say that the difference is due to bilingualism and not due to all of these different social demographic factors that we're discussing may be complicated. And that's why it is very important, because this is, again, like mentioned here, and this is also not even breaking it by language use as well, because there is some studies to say that the type of bilinguals in terms of languages being used, whether is it English and Spanish, English and Mandarin, and in other languages may impact as well their association with cognition. And so, because here in this bilingual group, people preferred for French speakers, Italian speakers, Russian as their dominant language. And now let's ignore the monolingual group and let's just look at bilinguals and then describe them between active and passive, right? Active were the ones that say that they use 2 languages every day. Passive are the ones that say they really only use 1 language mostly, but the second language they do use it every other, in some other context, but not as balanced as the active bilingual group. So again, they're going to cost the entire group. So here we still see, so passive bilinguals tend to be older now. There's really no differences in terms of years of school completed and gender distribution. We do see differences in terms of ethnicity, where now the active bilingual group are primarily Hispanic. There's no differences in income level at this point. There are differences in parental years of education now, where the passive bilinguals have higher childhood SES. So now the active bilinguals tend to be younger, Hispanic, and with lower childhood SES. And they were mostly tested in Spanish as well. And there's a higher proportion of them that are by immigrant as well. So there's about only 36% of the active bilingual group were born in the US. So again, we're not breaking it down by language. These are all English and something else bilinguals, not just English and Spanish. And so again, but now we're seeing how some of these relationships are being flipped even within the bilingual group. So further indicating why it's important to evaluate within these groups. And then we move forward to the next slide. Let's say now we only look within the Latinx group. We choose to ignore the African-American group and the non-Hispanic white, given that they're using different languages, and also just thinking about the cultural backgrounds and the sociocultural histories of these individuals may not be the same, which is important as it relates to these issues of bilingualism, and as well as from the last model in terms of cognitive aging as a whole. So this being said, so now looking within only the Latinx group, we see that passive bilinguals tend to be older, mostly female, with lower years of education, with lower income, with lower childhood SES, who were mostly tested in Spanish, and they were the majority were immigrant as well. So we're still finding differences between the active and passive bilingual groups. One of the biggest ones that we're noticing here, the difference is the immigration status, whereas the other factors, they still continue to differ, but maybe to a little bit of a less degree as before, but they're still differing. But at least here, though, we would feel a little bit more confident of the unmeasured confounds that may exist between these groups, right? But one could argue actually that then to further refine your group to appropriately evaluate whether bilingualism may provide some kind of impact on cognitive functioning is to then let's limit it within to only those who were immigrant. So we're now only looking at the immigrant group who are Latinx, who are bilinguals, right? And so at least they're about the same age. There's no difference. They're a little bit older, the passive bilinguals. There's still a difference between gender, where passive bilinguals tend to be mostly female. There's differences in years of school, where they have fewer years of education compared to active bilinguals. Still a lower income. And in terms of parental and childhood SES, there's no real difference, but there was a difference in terms of the language preference, in which most of the passive bilinguals were tested in Spanish, whereas the active bilinguals were half and half. And so now here, we've refined it further. Some of the critical associations of childhood, for example, are gone now. They're not necessarily as pronounced as before. And so any associations that we may find from this, we might feel more confident about how we might interpret our results versus, let's say, from the very first slide of just saying bilingual, monolingual, doesn't matter the race, doesn't matter the ethnicity, doesn't matter the languages that they're using, and then let's just evaluate any of these differences. Because as I mentioned earlier, it's incredibly important to understand all of these moving pieces in terms of a life course approach to truly evaluate whether bilingualism may provide some kind of protection. And you may think about it the same way, not just in bilingualism. It's really important to understand, especially when working with such diverse communities. And so in conclusion, we need detailed characterization of various aspects of bilingualism, such as age of acquisition, frequency of language use, proficiency, etc. Also, we need study designs that should carefully consider issues related to causal inferences and appropriate assessment of cognitive reserve. As I mentioned earlier, that we would require either ideally evaluations of brain health status or known AD risk factors, and appropriate clinical and cognitive evaluations, and ideally over time. And bilingualism has to be considered within the sociocultural context of the given study population. You cannot just assume or generalize that all bilingual populations are the same and that all the factors that led to one becoming a bilingual is the same across different contexts. It's even within here, the studies in the United States that I've had the opportunity to work with, working with bilinguals here in the Northeast, who are primarily of Caribbean descent, primarily Dominican, may have a very, very different sociocultural background histories that influence, health overall and bilingualism compared to the immigrant populations from the southwest of the U.S. and with, like, for example, from the studies from California, who are primarily Mexican, their immigration histories are very, very different, and it's important to understand these factors. And so in conclusion, I just would love to acknowledge all my mentors, Dr. Manley and Dr. Brickman, and collaborators from our labs, the Manbrick labs, and other co-authors and collaborators from across these several projects and our funding sources. And this is just a few photos of the people that I've worked with from our labs and our collaborators across from studies from attending different workshops, such as the advanced psychometrics methods in cognitive aging. And then that is my Twitter handle, and as well as the lab's Twitter handle, the Membrick Labs. Feel free to follow us, and looking forward to hearing any questions that you may have about this. I hope you enjoyed the presentation.